Hello, my topic is Ticagrelor in patients with stable coronary disease and diabetes. Definition: Ticagrelor is an antiplatelet medication that is used for the prevention of arterial thrombosis. Stable coronary heart disease is due to poor circulation through the blood vessels in the heart. Diabetes is a chronic disease that appears when the pancreas does not produce enough insulin or when the body does not use the insulin it produces effectively.
Two out of three adults with diabetes have high blood pressure. Experts say this is a deadly combination that can lead to an increased chance for a heart attack or stroke. Current guidelines suggest aggressively lowering systolic blood pressure below 130 in diabetics can help prevent heart attacks and strokes. Now, University of Florida researchers warn that lowering blood pressure below 130 doesn't benefit patients with diabetes, and lowering blood pressure below 115 can be harmful.
We found that less than 115 was significantly associated with increased risk of death compared to blood pressures of between 120 and 125 and 130 millimeters of mercury systolic.
UF researchers say their study suggests systolic blood pressure above 140 is associated with increased risk, and the best systolic blood pressure for people with diabetes with coronary artery disease is between 130 and 140.
Hold that deep breath in for the old 10-second count.
This research could lead to new guidelines that may help physicians treat people with diabetes who suffer from many different health threats.
We don't have to work so hard at getting blood pressure down so low. Maybe patients can take 2 drugs instead of 3, achieve blood pressure that is beneficial, and maybe focus more on their glucose or focus on some of the other manifestations of their diabetes.
Patients with coronary artery disease and diabetes should speak with their primary care physicians about any concerns they have regarding their own health and these new study results. At the University of Florida, I'm Chris Bilowich.
Application in nursing: taking an anamnesis, monitoring of ECG, take vital signs, place near defibrillator, oxygen therapy, reassure and explain to the patient what their situation is, where they are, and the treatment they are going to receive, asking them to remain calm and at rest.
Linking diabetes and cardiovascular disease. Meet Michelle. Michelle enjoys spending time with her family, and in her spare time, she loves to cook and catch up on her favorite shows. She also has diabetes. And like many people with diabetes, she doesn't know there's a link between diabetes and cardiovascular disease. Cardiovascular disease includes conditions such as heart disease and stroke. If you have diabetes, you are more likely to have risk factors associated with heart disease, including obesity, high blood pressure, or high cholesterol. These put you at risk for heart disease and stroke. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart. And adults with diabetes are nearly twice as likely to die from heart disease or stroke as people without diabetes. But there's good news for Michelle. She can take steps today to reduce her risk, and so can you. Here's what you can do to protect your heart. Manage your diabetes ABCs: A1C, blood pressure, and cholesterol levels. Ask your healthcare team what your goal should be. Develop or maintain healthy lifestyle habits and learn ways to manage stress. Take medicines as prescribed by your doctor. Stop smoking or using other tobacco products. With lifestyle changes and a treatment plan from her healthcare team, Michelle can look forward to living a healthy life, and someone's very happy about that. So take diabetes to heart. Visit niddk.nih.gov.
Pros and cons. Pros. It is usually used once you have had a coronary problem and the rate of new cardiovascular events decreases. It plays a fundamental role after coronary intervention, that is, after implanting stents to keep them in good condition and prevent thrombo from forming inside them. They are usually used temporarily, 1 month a 12 months. Counts. They can present symptoms like hives, difficulty breathing, edema on the face, lips, tongue or throat, bleeding.
From PCR Online. What are the main lessons of the recent trial THEMIS?
The THEMIS trial was a massive trial including more than 19,000 patients, conducted in diabetic patients with evidence of coronary artery disease, mainly prior CABG, prior PCI, or at least a 50% diameter stenosis coronary disease. So these patients were randomized to receive either Ticagrelor on top of aspirin or aspirin alone. And actually, after a follow-up of 4 to 5 years, there was a modest significant benefit of Ticagrelor on top of aspirin with a 0.7% difference and an hazard ratio of 0.9 with the higher confidence interval of 0.99, so almost touching the unity line. Conversely, the use of Ticagrelor was associated with a significant increase in major bleeding, minor bleeding, and bleeding seeking medical attention. So the main message is that there might be a population of diabetic patients with low bleeding risk that might benefit from using Ticagrelor in prevention, while patients at high bleeding risk should stick with aspirin only.
I should apply in Ecuador. 80 patients received treatment with Ticagrelor. 42% present a clinical picture of stable ischemic heart disease and 58% with acute coronary syndrome. Regarding major adverse events, did occur in 2.5% during the first 7 days of hospitalization. Conclusion. Treatment with Ticagrelor reduced the incidence of death from vascular cause, myocardial infarction, or stroke in patients with acute coronary syndrome. The benefits of Ticagrelor were obtained in patients with acute coronary syndrome, with or without ST segment elevation, without increased rates of major bleeding, and were independent of the strategy followed in the treatment of ACEs, invasive or conservative.
Hi, we are here in Paris with Pierre Sabouret, commenting the trials of the ESC Congress for PCR Online. Pierre, what are the results of the THEMIS and THEMIS PCI clinical trials?
So we'll focus on THEMIS PCI. THEMIS PCI is a randomized clinical trials evaluating the benefits of
dual platelet antitherapy with ticagrelor and aspirin versus aspirin alone. When you see the results, you have a net clinical benefits with a combination of ticagrelor and aspirin only with patients with an history of PCI. You have no benefits where there is no history of PCI because you have a reduction of ischemic events, but an increase of major bleeding. But for patients with an history of PCI, you have a net clinical benefits of 1.5%. That means that you reduce ischemic events with low risk of major bleeding. For the other end, the other group, you have no clinical benefits. So it's quite clear for patients with CAD patients with PCI and low risk of bleeding, you can use the dual antiplatelet therapy with ticagrelor and aspirin.